Hey guys, it's Tommy. Welcome to my channel. Today I'm basically just going to be talking about tips for new graduate nurses that are just entering the hospital. I have been a registered nurse since September of last year. I started working at my hospital system at the end of October. Most all of my experience is on a multi-system PCU floor. So if you guys don't know what a multi-system PCU floor is, get like a whole bunch of different things. You can get patients with pancreatitis. We see a lot of those, with a lot of kidney issues. And then there's also a good amount of ortho cases. It's kind of just like a mix of kind of everything. Today I just kind of want to focus on some tips for new grads. The first thing I want to start off by saying is that every new nurse is different, and you're going to find your own things that you will like that may not necessarily be the same as somebody else's. Time management specifically, there's a lot of time management qualities and things you're gonna pick up that you yourself are probably gonna find easier as compared to somebody else. That's okay, that's normal. So I just wanna lay that out and get that down. If there's something that you do that your preceptor doesn't do, and you find it more comfortable, and at the end of the day you're still getting your work done, you're still making sure that your patients are safe, that's really all that matters. Okay, so tip number one, whenever you are walking onto the unit and you first are looking at your patients, the first I always look at is my lab work for the patients. So I look at what their lab work has been the past few days. I definitely look at trends, the electrolytes, usually the potassium, magnesium are the two specific ones. If the sodium has been kind of out of normal range, I will look at that as well. Just kind of see what's going on lab work wise with the patient. And the next important thing that I like to look at is progress notes. Probably going to be one of your best tools as a nurse to kind of track the progression of how the patient has been doing and kind of like what's the overall plan for the patient. On our floor we do rounds with our charge nurses. Our day shift kind of does a case management round to kind of collect the data to see what needs to be done in order for them to get discharged. I'm night shift, so we do the same thing, but it's not with case managers, it's just with a charge nurse. But regardless of whether you work days or nights, you always got to know the plan for the patient. It's your responsibility to know if there's any barriers to discharge, if there's anything kind of out of the ordinary that would keep them in the hospital. Always read your progress notes. And kind of get the overall picture of the patient. The last thing that I really like to look at when I'm looking at my patients is their vitals, and I also look at the medications that they're going to be getting for my shift. So obviously, you know, one of the big things of being a nurse is administering medications to patients. The things that's most important that will help you right off the bat starting your shift is knowing all of the med times and writing them all down on a piece of paper. When you write down the med times and you kind of organize yourself for every patient, it gives you like a better idea of who you got to see after you do your assessments and your initial vital signs. A really good thing is having a complete list of all the medication times for every single patient like on one paper, so that way you can just pull out your brain sheet. That's what I like to call it. You pull out your brain sheet and you can just kind of look down the list of who needs meds at 1900, 2000, 2200. So definitely look up vitals, progress notes, lab work, and medication times. Those are probably the big ones. There's also other things you can look up too. Any diagnostic test that they've had done, like an MRI or a CT scan. Tip number two that I have, don't be scared to ask for help. One of the biggest things about being a new nurse is the fact that you're new and you have absolutely no idea what you're doing. It's gonna take some time to be able to handle the amount of stress and the amount of kind of mental organization that you have to do when you start your shift, because it can be very easy to be kind of thrown off of your game plan. You have to be able to kind of put yourself back on the train and just kind of keep going. That takes time. It took me about, I want to say, a good 3-4 months to finally be able to just do what I need to do. If something happens and I get off track, then I can put myself back on. So it does take time. It's not something you're going to learn overnight. But when you have to ask for help because you're just too swamped with too much, please, 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 please do not hesitate to ask for help. 9 times out of 10, you will have great coworkers that will help you out no matter what. I definitely know day shift is more busy, so sometimes it can be a little bit more difficult to ask for help with days because everyone else is like doing their own thing. But night shift, definitely it's a different type of busy, but they are probably, like I said, 9 times out of 10 more than willing to help you, and then you can help them in return. And it's a teamwork. This thing is all about teamwork. You're not on your own. You have your own set of patients, but if you need help with anything, please, please don't hesitate to ask. When you build trust with your coworkers and they help you and you help them, it's such a positive atmosphere that actually allows you to you put your trust in your coworkers. And when you have that, it's honestly priceless because, that's going to apply to so many different things in the future. I mean, you'll have rapid responses, you'll have codes, you'll have all these different things, and you know that you'll be able to trust your coworkers. So that's definitely something I recommend. Always ask for help. Tip number 3, make sure that you keep yourself organized. There is a big difference between time management and organization. Time management is something that kind of comes with organization. They work together in the same sort of sense, but you can't have good time management skills without good organization skills. What I mean by that is, let's say you are looking at your patients, you're working on a step-down unit, and you have 4 patients for that shift, and you see that so-and-so and so-and-so have wound care orders that need to be done during your shift. And let's say the other 2 have medications that are time-critical medication. If you don't know what that means you have to give the medication in a 30-minute window. So that means if the med is scheduled at 3 a.m., you have 30 minutes before 3 and 30 minutes after 3 to give the medication. So let's say you have all that going on. Organizing yourself is really important in order to make sure that you have good time management skills. The way that I like to organize things is on my brain sheet. I kind of have like an area that's over on the back. It's kind of like my tasks and to-do. I will kind of like do like little check boxes, and I'll write the task, like I'll make a little box and I'll say wound care. And I'll do that for the patients that need wound care. I'll do that for the patients that need other sort of orders that are in their chart. Knowing when to do them is really important. Most of the time, the first 4 hours of your shift are going to be the most busy, so get all of your medications, assessments, and vitals out of the way the first 4 hours of the shift, and then worry about like the wound care, changing of tube feeding tubes and labels, kind of all that stuff like later in the shift. It's not a priority at the moment. The priority is getting the patient their medication and doing your assessments. That's definitely that takes priority. Okay guys, my last tip, nursing is hard. It's not an easy thing. It has never been an easy thing, and it probably will never be an easy thing. There's gonna be shifts where you're going to come home and just sit down and be like, what the heck just happened? And that's okay, that's totally normal. There's a lot of times I have come home and I have just been so emotionally drained. I have, contemplated quitting. It's a very, very difficult career, and it's even more difficult when you have the weight of being new on your shoulders. Don't give up, it's okay. Everything will be okay. They say it takes about 6 months to a year for you to finally start getting comfortable with being a nurse and calling all the doctors when they need to be called, handling rapid responses, handling codes. If you're on a unit that's very teamwork based, that's definitely gonna help with a whole lot of things. If there's ever a time where you feel like it's just too much and you don't think that it's something you can do, just remember that every single new nurse, regardless of how they act and regardless of what they say, at one point they went through the same thing, and everybody has a hard time when they're new. It's okay, you will make it through. I am here to say that you will make it through. Okay guys, so that's all I have for this video today. If you want anything specifically for me to talk about, just leave it down in the comments below. I will see you guys later. Bye.